We are beginning. Welcome to the board's November 5th to 6th, 2019 board meeting. Once again, for those of you who have been here today, my name is Greg Lippy. I'm acting president of the board. As I call this meeting to order, I'd like to advise all members of the public, both present or watching the meeting webcast, that the board is a consumer protection agency subject to the Open Meetings Act. The board's strategic plan establishes standing committees through which the board establishes its goals and organizes its activities. Each of these committees is comprised of public and licensee members. The committee structure provides an important venue for ensuring that staff and members share information in crafting and implementing objectives. These meetings also provide an opportunity for stakeholders' involvement, and public comment is encouraged. Following committee meetings, the chairs from each of the respective committees provide reports to the full board as part of board meetings. Committee recommendations on policy decisions are referred to the full board as the final decision maker. As included on the agenda, during this meeting, the board will receive reports from chairpersons of several of the board's committees. The meeting is being webcast. We respectfully request that when called upon to speak, please come to the speaker's table and speak directly into the microphone. This will ensure that those individuals watching the webcast are aware of all discussion and action. As indicated on the agenda, the board has a significant number of items for consideration. Items may be taken out of order. If necessary, public comment on the various agenda items may be limited to 3 minutes per individual. We ask that individuals providing public comment be respectful of board members' time and refrain from restating comments previously considered by members of the board, whether those comments occurred during the committee meeting or during this meeting. Thank you in advance for your consideration and cooperation. The board will convene in closed session during this meeting. Upon conclusion of closed session, the board will reconvene in open session and will adjourn the meeting in open session. The board does not intend to webcast that portion of the meeting. I thank you all for attending, and I look forward to a productive meeting. I will now take a roll call to establish quorum, starting on my left.
Alan Shadd, professional member.
Greg Lippy, public member.
Shirley Kim, public member.
Ryan Brooks, public member.
Ricardo Sanchez, public member.
Debbie Veal, professional member.
Maria Serpa, professional member.
Albert Wong, professional member.
Thank you. Quorum's established. Okay, next is public comments on items not on the agenda and agenda items for future meetings. Please come up.
Thank you. Steve Gray on behalf of CSHP. CSHP has taken the opioid epidemic crisis very, very seriously and has had for the last year or more a task force working on various things that could be done. And so I have a request from the co-chair of that task force, Sandy Bardis, where they basically have developed a video, and if you don't mind, it's short. I'll just read what she asked me to say.
Sure.
It says, "Thank you much for the opportunity to tell you about our video regarding the use of naloxone. The video presents the signs and symptoms of opioid overdose, names of opioid medications, and the use of naloxone and calling 911. The target audiences are teens and young adults," that's a very important aspect of this, "who would find this teaching format to be more easily watched than reading a pamphlet. It is 3 minutes and 27 seconds long and is packed with information for an audience who is often in a position to recognize a friend or family member who is at risk for opioid overdose. We would like this video to be included on the Board of Pharmacy website under important information for consumers. Also, we think that it would be beneficial to add it to the naloxone protocol and training webinar. The video can be accessed through YouTube, and then I have the URL you can get here. I'll give this to you. The video is free to share and has no copyright restrictions. The music and lyrics are all original and were produced by the California Society of Health System Pharmacists Opioid Stewardship Task Force. Please do not hesitate to ask her, not me, any questions. I really appreciate your willingness to present this. And I think this has added information, again, because of the target audience. And when you see it, it's clearly not for someone my age. But, and also there was, I want to call to your attention, a special report in on the web this morning, or maybe last night, about how they have intercepted, the DEA has intercepted drugs coming into this country from Mexico that are laced with fentanyl, as perhaps an attack on the on the country. So I'll give this to the staff.
Thank you.
Yeah, thanks, Steve. I saw that video too, and it's definitely not for your age. For my age, it's probably pretty appropriate. But
Should be, because it's my understanding that the opioid crisis does affect a lot of men in the age bracket that you are in. And I, too.
unlike yours, yeah.
Good afternoon, members. Danny Martinez with the California Pharmacists Association. Earlier today, the compounding committee had a meeting regarding the how we're going to move forward with the regulations relating to compounding. Given that the text of the regulations was not agendized, I'd like to ask, and given that we've submitted a letter to the board relating to some items on the from the sterile compounding, I'd like to request that the package of sterile compound regulations that the compounding committee considered be sent back to committee for further consideration with respect to our letter and our suggested changes and amendments that we've requested. Thank you.
Thank you.
Good afternoon. My name is Corey Edwards, and I'm a pharmacist here on behalf of myself and hopefully some of my colleagues. And I apologize in advance if anything I address today has been previously addressed in the committees, as you stated. I'm here to ask the Board of Pharmacy make information and documents potentially available to the public about operations of the Board of Pharmacy. I've searched the website and I've emailed the board with no success, but I'm specifically interested in shedding some light on things like, what is the annual budget of the board? How does that compare to funds directly paid by pharmacists, technicians, and interns? What is the annual payroll, accounts payable, and other financial obligations? What is the volume of work accomplished by the board's officers, inspectors, and other employees? And how does this information compare to resources and activity of other states' boards of pharmacy? I'm concerned, and I'm asking this question to you because in the 4 years that I've been a licensed pharmacist, I've observed what seems to be a disproportionate experience as a licensee as is experienced by pharmacists in other states. Examples include the timing it takes to report board exam results and licensure, reliance on deprecated technology like snail mail and fax machines, lack of resources specifically pertaining to information technology, as I was made aware that you have 2 full-time equivalents or around there dedicated to IT, and more recently a concern related to the lengths of investigations, specifically with the CPJE examination. I don't know if I'm personally able to request an audit of the board, but if necessary, I would gladly go to my state legislators to get this information. I believe that's the best way for those of us that are licensed to objectively measure the performance of a governing body that we must answer to and is the ultimate authority over us.
Well, that's very well stated. And your points, you could be a member of the board. We all have these problems too. Mm-hmm. But also, it rankles me a bit to hear this because this has been discussed ad infinitum. And if you go back in our minutes, all this is available. And it's directly accessible. It's not hidden. It's not easily accessed, but it is available to the public. The salaries of all the members are available of the organization. Anybody can get that almost immediately. As far as efficiency goes, as far as the antiquated computer systems that we're forced to use, as far as manpower goes. And yes, definitely, California is different than every other state. Everybody knows that. That's nothing new. So your points are valid. However, implying that it's hidden is somewhat insulting because the members of this board, the public and the pharmacists are trying to make this board more and more transparent. As a matter of fact, there's been a number of laws that have been discussed. Some of them are making progress. And we understand what you're saying. We've been addressing it, and the progress is slow. It's unfortunate that it is, but nonetheless, that's the way it is. However, all this information that you asked for is available.
Does that include comparison with other states?
No, not comparison with the other states, because
what
we're
I was
not,
getting at.
but because we're not comparing to the other states. California has its own distinct legislature, legislation, and rules and regulations. We're not trying to be like Idaho. We're not trying to be like Oregon. We're trying to be like California. So and Arizona and Idaho members sit in the audience right now. And so, you know, as far as comparing us to other states, we should be like somebody else. I don't think that's going to happen in California.
So in that case, I'd like to.
Alan, really quick, can I add on to that because I think you're 100% correct. So you can do a public records request, but we're going to let you know that all that information, the statistical data, is on our website already. So I'm assuming you've already done your homework, you downloaded that, because this information that you just asked for is on our website. So I'm assuming you've already done that.
I've looked, but I haven't found the information I was specifically looking for. And to the previous gentleman's
Let me
point.
finish with one last point.
Okay.
And so we have publicly identified information that you can get. This board is not obligated to put together research papers, you know, for yourself. We don't do that.
Okay.
So information that you're asking for, it's on our website.
I appreciate your points, and I would like to get back to the point that you said about implying that or making any sort of implications as to the operations of the board. That wasn't my intent. My intent is to get this information because I believe that if there are resources not applied proportionally to the amount of constituents and licensees that you serve, I believe that it's our duty as well, licensees, and is also with the rest of the citizens and consumers of California, that we can demand that our legislators mark more of a budget for you because I believe that it's potentially needed. I'm not going to tell you how to do your job. I'm just saying by the very few amount of years that I've been in practice, there are things that we all would like to be a bit improved. Am I right? So I didn't mean to imply anything negative, but I have been surprised and slightly disappointed by some of the more recent events, specifically, as I mentioned, with the CPJE.
That is absolutely true. We, as a board, are overwhelmed with the amount of cheating that has gone on. I don't think it portends well for the board, for the state, for the students that took it, for those that are involved. It's really not. Oh, okay. Excuse me. All right.
I understand this is not
Maria, you wanted to
discussion.
say-
I understand this is not discussion, but I wanted to point you towards our meeting materials because about at least more than half of the requests that you made are in this meeting's materials. So if you go look at there, I think you'd be able to answer many of the questions you posed to us.
Okay.
Great.
Yes.
And also, we are not paid staff here. The board member do not get paid. We all volunteers.
Again, I don't want to make any implications of the.
The implications you've made.
Yeah.
Okay.
All right. Easy. We're not really
I'm-
supposed to be discussing.
I'm here to express my concern as somebody who could have had this happen specifically with that issue, but also other issues. And I think that we can
Understood.
serve each other better. And that's what I'm asking for. I want more information so that I can go to my state legislator and say, my board needs more so that I can help them help me take care of my patients.
That wasn't what I heard at the beginning. Thank
Well, you interrupted
Okay.
me.
Thank you. Thank you for coming up.
You know,
Thank you for
can I
listening.
just add one little thing? A lot of times when we're looking at certain activities at the committee level, we do compare, look at what other states are doing to make sure that we, are aligning. Do we do that for everything? No, but we do, look at and see if there's, there's no need to reinvent the wheel. And so if we don't need to reinvent the wheel, we'll, look at what other states are doing.
I appreciate your comments. Thank you for listening.
Okay. Any other public comments? Okay, moving right along. Approval of the July 24th, 25th, 2019 board meeting minutes. Do I hear a motion to approve?
So move.
Second?
Second.
Okay. Any public comments on the meeting minutes? Okay, all those in favor of approval? Opposed? No abstentions? Okay, thank you. Now, we're on the September 13th, 2019 minutes. Motion to approve? Anybody?
No, sir.
I'll make the motion.
Okay. Okay, thank you. Any public comments? All right, all those in favor? Unanimous. Okay, thank you. And we now have approval of the October 3rd, 2019 board meeting minutes. A motion, please?
You know, can I actually kind of step out here and say,
Should we
I
do
will
them all
make a
together?
motion to
Do
approve
them all.
October 3 and 14 since they were
Thank you, Debbie.
both canceled.
Okay. Okay. Who's second? Ricardo. Okay. All those in favor? Thank you. It's unanimous. Okay. Next, we're up to the recognition and celebration of pharmacists licensed in California for 40 years. And we actually have somebody that's been licensed for 50 years. And his name is Dan Furtado. And please come up to over there.
Your voice carries.
Dan, congratulations. Thank you. You have a very impressive career, so instead of me reading it, I'd like you to tell the group about your background.
All right, thank you. Well, I am a graduate of UCSF, class of 1969. Becoming a pharmacist was something that I wanted to do since I was a freshman in high school, so I was very glad to have actually completed that goal. I went on active duty with the Army for 2 years. I was a pharmacist at Fort Sam Houston, Texas, and San Antonio during the Vietnam War. Subsequently, I stayed in the Army and retired as a full colonel. I was a brigade commander when I did retire as a pharmacist. And immediately after active duty, I worked at the VA hospital in Palo Alto for about 7 years. I was the clinical coordinator there in charge of the residency program. Then I worked for O'Connor Hospital in Campbell, where I live actually and grew up, and in a chronic pain management clinic there. This is prior to the current crisis, obviously. Worked there for a short time, but then I was asked to go to Stanford. I had been doing some part-time teaching there and accepted the position of Associate Director of the Physician Assistant Program and taught pharmacology for 42 years. So in all of my interaction, I felt very proud to be a pharmacist and encouraged all of my students to make sure that they continue to ask their pharmacists for support and help in their work and in prescribing medications. And that was the major portion of my career. I also served in public office for about 15 years. I was a member of the City Council and 3 terms as mayor of the city of Campbell.
So what would you advise a new pharmacist starting out today? What would you consider to be one of the most important things for them to know or do?
Well, I've had the opportunity to work with some pharmacy students throughout the years, and the same for other students as well. I always encourage them to get a broad-based education, because no matter what, you sometimes think you have an idea of what you want to do, and you're kind of majoring in that field, and then all of a sudden your job turns out to be a lot different, or there are additional expectations. And so I think broadening your education, I still consider myself a student after all these years, and I think it's extremely important to just get a broad-based education and continue to remember what your basic responsibility is, and that's to serve the patients that you interact with primarily.
Great. Congratulations again. Here's your pen.
Thank you so much.
And do we have a camera here? Okay. Congratulations.
Thank you.
Steve graduated that same year.
Okay, that's one of the more pleasurable tasks of being acting president. Okay, the next item of today is the election of officers. It's time to elect a president. Do I hear
Can
any
I make a
nominations?
motion?
Yes,
I would like to nominate Greg Lippy for president.
thank you.
I would like to second that motion.
Thank you. Do we have any other nominations? No?
It's just the president, not the vice president.
Not yet.
Okay.
Okay.
Everyone's too smart not to do that.
Do them all at once.
Well, all those in favor of Greg Lippy being president, raise your hands.
Can we debate this?
Thank you all. Thank you very much. I would now open
I have
up
that
for nomination.
awkward, sorry, this is very awkward, but technically, we're supposed to take public comment on the motion, so
Oh, public comment.
public has comment, then the board can decide whether to reconsider its
Okay.
vote.
No public comment? Thank you. All right, now it's time to nominate a vice president, and I nominate Debbie Veal.
Was that quid pro quo?
It looks that way.
It
doesn't it?
doesn't, yeah.
Second over here. Any other nominations? Albert.
I would nominate Maria to be a vice president.
Okay. So we have two nominations. All those in favor of Debbie Veal, raise your hand. I can't do that. I have to get more public comment. Is that it? Okay. Public.
My recommendation would be first to ask for public comment, and then I'm not sure how this board has handled it in the past, but you can, instead of calling each name individually, you can just call roll and see how people would want to vote.
Oh, okay. That sounds better. Public comment. Okay. Now I can call roll. Albert, your vote.
Who do you vote for?
Your vote for vice president.
She wants us to say
One at a time?
Yeah,
So, one person at a time?
yeah, each person vote, each person say who you're voting for.
I vote for Maria.
Okay. Maria,
I thank Albert, and I vote for myself.
okay. Debbie,
I guess I'll vote for myself.
Ricardo,
Looks like it's gonna go that way, but I'll go with Maria on this one. Maria.
okay. Ryan,
Can I vote for both?
I wish,
Because
I
I
wish.
wish there was a one for Debbie going around and one for Maria going around, because I would have voted for both.
When you abstain, you vote for both.
Yes.
Well, I've been advised to do it this way.
I vote for Debbie.
Okay.
Debbie?
Debbie,
Now, I applaud Maria's qualifications, as we all do, and I've said I was going to vote for Debbie in the past, and I continue to vote for Debbie. But Maria is an excellent, excellent choice.
and I look forward to Maria in the future. Okay. Well, it looks like Debbie, you're vice president.
Thank you.
Thank you. And Maria, look forward to you becoming an officer in the near future. Okay, time to move on.
Congratulations, Mr. President.
Thank you. Yes.
Yeah, and now you're official, you have to call yourself interim.
Okay, now,
And just to interrupt you one more time, I'm sorry about that. I'm not entirely sure the term of office. As I understand it, you were fulfilling the remaining term of office, and I don't know what that
correct,
was.
it's to June 30
Till June 30th?
of 2020, yeah.
Okay, so do you want to clarify that with a motion that these terms of office run to
Okay,
fill the unexpired terms of office?
okay.
Yeah, if you can just say expired a term, that would be preferable, because I think they take effect June 1 maybe, but I'll confirm that.
Okay, so this is for the expired term, to fill the
The unexpired
current
terms.
term. Okay. So you say it has to be a motion? Or just a
So,
statement?
so basically, so I'd like to make a motion to have the term go through the through the unexpired term until either May or June 30th, whatever the correct date may be.
Okay,
Could I get a second on that motion?
I'll second it.
Second.
Okay, all those in favor?
Public.
Public is, okay. All those in favor? Thank you. Now, next item. No, I'm shaking up here. I can't go on. Okay, American University of Health Sciences. I now call your attention to item 6 on the board's agenda. Discussion and consideration of request from American University of Health Sciences School of Pharmacy for board recognition pursuant to Title 16 California Code of Regulations, Section 1719. I trust everyone had an opportunity to review the information. Are there any questions or comments from members? No. Any questions or comments from the public? I would entertain a motion on this request. Okay, Ricardo, motion.
I'll second.
Second by Debbie. All those in favor?
Comment?
Well, I asked for public comment already. Yeah.
And this is just to clarify, but the motion is the one that was recommended in your materials to grant
Right,
board
to grant
recognition
them, yes.
to American University of Health Sciences School of Pharmacy for purposes of issuing intern licenses.
Correct. Okay, so all those in favor? Was that a hand? Okay.
See, Alan, it's not just me that can't see that.
Looks unanimous.
You guys talked about it.
Okay. Okay, the first report today is under the purview of the Organizational Development Committee. Committee has not met, so I'll be providing informational updates on general items. First is budget update report. Starting with a report on our budget, as indicated in the meeting materials, fiscal year-end figures are not yet available for 2017-18 and fiscal year 2018-19. Also, as included in the meeting materials, the board's authorized expenditures for the current fiscal year are approximately $26 million, which is close to an 11% increase from the prior year. Preliminary revenue details indicate that the board has received over $10 million thus far and has expended about $5.3 million so far. The fund condition report includes estimates that by the end of the fiscal year, the board will have less than 1 month in reserve. This will change if the board's fee increase takes effect April 1, 2020. Members, are there any comment on the budget report? Any comments?
The only comment I'd like to make, and I don't know if the individual is still in the room.
He's here.
Okay, is that, there's the budget information, but I think he also kind of implied that maybe the legislature throws us some money, and we might just want to point out that we're a self-funded
Right.
organization, so talking to our legislatures, they don't really throw any money our way.
Correct.
So we can get more money, but that means we have to increase fees.
Exactly. Okay. Any public comments? Nope. Okay. Board member attendance information. Attachment 2 includes a summary of board member attendance for the first quarter of this year. Thank you all for your commitment to the board and its mission. Are there any member comments about the attendance? Any public comments? Okay. Next is an update on implementation of the acceptance of credit cards for renewal payments. Our next agenda item provides information on acceptance of credit card payments for renewals. As indicated in the meeting materials, data demonstrates that overall renewal payments received online accounts for about 1/3 of renewal payments submitted. Are there any member comments? Are there any public comments? Okay, Sunset Report update. As we've discussed for a few meetings, the board will be undergoing the sunset review process this fiscal year. Attachment 3 includes a draft of the report. As indicated in the committee meeting materials, some data points are still being compiled and formatting will be finalized at the end. The final report is due to the legislature by December 2nd. As part of our discussion, I suggest we quickly review each section to determine if members have comments. Following the review and discussion of the draft report, I suggest we consider as part of our action on the report to delegate to select members, no more than 2, to work with staff to finalize the report. The delegation would extend to making updates to the report based on our discussion here, as well as confirming changes and updates made by staff. We will consider public comment on the report after a motion is offered. Should a motion not be offered, public comment will be considered following the board's discussion of the report. Okay, has everybody had a chance to read the report? Okay. Are there any comments at this time? I know I have a bunch, but is anybody? Please. Anyone have comments that they would like to make on the sunset report? I have to dig mine out.
Yeah, no, I'm just wondering. I don't know what the rules are.
Yeah, I should have. I would suggest we are going to proofread it. We're going to double check the data and everything
Yeah,
else.
I know,
So,
but this, go ahead.
yeah, so what would be helpful is to make sure that you all feel comfortable with the information. You have to respond to specific questions, so we provided you with that as well. So hopefully it's in fairly good shape. There are some items that are still in the process of being compiled, and there's one section where I'll provide you with updates on the information when we hit the section.
So maybe the way to do this, because I do have a number of comments, is that the idea is to appoint a couple people to work together with you. Is that correct?
So I think in general, the board
Updates.
needs to feel comfortable with the report because it is the board's report,
Okay.
and then you can delegate final approval of it. I'm looking at councils to make sure that I'm right about the legal process, but I believe that that's how it works.
So technically, you want it to be to one person, but it's okay to get information from other people. But ultimately, it needs to be one person that has the final.
Okay, so rather than take up time
Well,
here-
in the past, we had, I know last sunset, we had 2.
Yeah, and I just read that we were going to have 2. So,
So the issue is that if the board delegates its authority to more than one person, then whatever the action that happens has to be subject to a noticed board meeting.
Has to be subject to, because last time we delegated to the organizational committee.
Yeah, so I don't.
Which has
I
2
wasn't
members.
around, so at least I don't think I was around, and if I was,
Yeah, you were.
I goofed. So the 2 people, it could be that 2 people provide sort of input or multiple people provide input, but
That's
you
what
just
the-
need one final decision
oh,
maker.
yeah. it'll-
Oh, okay.
That's the idea, but,
Not that they can't give the input,
So it's hot water.
but it's just that we need it to be a single individual that makes the final, that has the final authority.
okay, so because I happen to have some things in here, rather than take up everybody's time, I'll just meet with you and we'll go over it. Okay. Is that okay? Okay. Well, that was quick.
I have a question.
Yes.
When will we have the opportunity to discuss the section at the very end, which talks about new issues identified in those 3 sections? Because I think that is, in addition to all the meatiness of the report, is the part that I am the most interested in. Is that occur at the future board meeting when we go through the final statement? That would be today.
So, yeah, please go ahead with your question.
Well, I guess it's more of a process.
Okay.
In looking at the report, the new issues identified are addressed in 3 different buckets as to, I can get my mouse to start working again. It's a long report, so my mouse is slow. New issues not previously discussed in this report is one
Yes.
section. And then there's new issues I guess it's not new issues previously discussed, but there's 3 buckets. Let me find the 3 buckets. Issues raised under prior sunset review that have not been addressed, new issues identified by the board in this report, and new issues not previously discussed. I like what is there, and I understand why they're there, but I'm just curious as to when does the board have an opportunity to say, is there something that we missed or some other thing that we should have added? Or, because I know throughout the year, we've always said, that's something good to add into the Sunset Route. I'm sure there's a parking lot and all those things got put back in here.
So that's what this discussion is about today. And so I think what we were trying to do is go section by section, but absolutely we are at the
We are
staff
gonna go
level.
section by
We are well, I think that's what Greg had proposed.
I'm
was
sorry, I
going
misunderstood.
section by
I
section.
heard that, I misunderstood. I thought that was not going to happen.
Well, I proposed it, but I thought I was kind of being overruled here.
That's what I heard. I heard you were being overruled. Yeah.
So maybe I shouldn't allow myself to be overruled. Why don't we go through it?
And perhaps we don't need to go through all the sections if that's the preference of the president and the board. I was just more interested in the meaty sections at the end, selfishly.
Okay, so.
I think
is
I
it-
think we should go through section by section because, and then make comments. Unfortunately, I'm having problems pulling it up right now, but do
Okay,
you have a hard copy?
It's,
I have a hard copy.
Oh, yeah.
yeah, the internet is slow.
Here, I'll share with you.
Which attachment is it?
Especially
Okay.
since you should probably have your own copy to take notes. That's Lauren.
Okay, so you want to start with the first section, which is brief history and function. In the second paragraph, it says, for example, in addition to non-resident sterile compounding pharmacies and outsourcing facilities that ship products into California, the board physically inspects the locations of automated drug delivery system machines used to store prescription medications. Should we also be including other main functions that we do in here? Is a question. Do you think so or not? Ann?
So I guess what I would say is this is trying to provide like some high level because there's a lot of granular detail within it. If you want to switch what we targeted, that's fine. We were more focusing on the direct inspection piece because that's one that people seem to,
Okay, so you wanted this just to be the overview?
yeah, because our licensing is a separate section, but it's your report, not mine. So
It's okay if that was the idea. All right with me.
Okay.
Okay. So are there other comments in this section?
You know, I apologize. I didn't hear exactly what your comment was.
Well, in the first, under the brief history and function, in the second paragraph, it talks about, today the board has 32 licensing programs. It talks about the different programs. And then it says, its regulatory jurisdiction is varied and complex, ranging from large institutions to small programs. For example, in addition to non-resident sterile compounding pharmacies and outsourcing facilities that ship products into California, the board physically inspects the locations of automated drug delivery system machines used to store prescription medications. And I just asked, should we be including other main functions that we do in this section? And, but Ann said that this was to be basically an overview. And because of the fact that we do address in the rest of the report other functions that we do. And so I said, okay.
So I think the other thing that I would say is, to me, that is not a hugely substantive change. And so I think that that's the kind of thing that, however we end with the delegating or whatever that looks like, I think that
Right.
that's something that, right, it doesn't seem substantive to me. I don't know if other people
Yeah,
feel that. It doesn't.
It's okay. Okay. This is kind of not going smoothly. Um, So Maria, was there, did you
Well, so
have
I-
suggestions as to the new issues, additional issues that you wanted to add?
On the last part,
Yeah.
I thought that maybe we should have at least a little bit of a discussion as to why they're there, and maybe are there other, oh, sorry.
Okay.
Well,
Sorry.
are you jumping to the end? I mean, so under, I mean, so this needs to be updated, it's like under enforcement.
Yes, what would you
Should
like?
we also be mentioning the compounding?
So I think it's under ad hoc committee. Maybe we missed it, but I think it's under the ad hoc committee.
Oh, I was thinking that, because I was thinking that the ad hoc, I thought it came out of enforcement.
So in our, so how we structured it was how we have our strategic plan with the committees that way, and then the board's procedure, administrative procedure, allows for the establishment of an ad hoc committee. And so that's how we did it with how the board's procedure manual works, but I'm happy to move it to a different section within the report as well.
Yeah. And I guess it's just, and maybe I'm thinking people are going to read this more than, we probably read it, but I think it's been such an important factor that just calling it an ad hoc committee, I mean, can we put hyphen compounding? I just feel like I kind of want compounding in bold letters somewhere, because you have to kind of read, oh, it's to evaluate compounding standards. Here's the current membership. You know what I mean? It's, that's a sensitive topic, and I think someone could flip through here and not even see that we have a compounding committee.
Sure. I mean, I don't think that's not a substantial add to it, so yes.
Yes.
I don't think that's a substantial add to this, so we can highlight it, do whatever we need to it. I don't think there'll be much objection to that.
And I guess even like under meeting quorums, I mean, we've really struggled to meet quorum. Do we mention that in here?
So most of that has happened outside of the reporting period. That's been this current fiscal year, and our reporting period ended the end of June.
Gotcha. Okay. Sorry, I forgot.
Okay, if you go to page 61 in the enforcement programs,
Or do you want to go to section, do you want to look at section 2 real quick? Are you
You
doing
have a
this section by
comment in there?
section, or?
we can. I thought you were running out of comments there.
I mean, I don't see any changes to section 2. It's mainly just,
Yeah, I didn't see any there. So if you don't have any comments up to page 61, I just have a comment on that page.
well, so in section 3,
Mhm.
and I don't know if this is the right place to put it, but the whole, our computerization challenge.
Yeah, so section 3 is fiscal issues. I think that we talk about business modernization elsewhere.
Okay.
But if we want to make it more pronounced or incorporate it in another section, we can do that as well.
I mean, I think it would be good to, have it in here a couple different times, because it is a huge challenge. All right, Greg, page 61.
Okay, page 61, there's a couple of things that I picked up on. It appears that our investigations are dropping percentage-wise. Is this because the volume's much higher, or what would that be?
I'm sorry, is it because of what?
Is it because the percentages are dropping? So are they dropping because the volume is much higher that we're applying our percentages against?
So
Or do you know why they're dropping?
do you understand the question?
I'm sorry, I'm having a hard time.
You said it, so the question is, the percentage of our number of investigations are dropping for this year from last year. What's the reason behind that? Are we not visiting as many pharmacies? Are there more pharmacies to visit, which will skew the numbers? Do we have less
Right.
employees now? I mean, what are the factors behind
Right.
the drop?
Can you just tell me what table you're looking at?
It's the top of page 61.
It's the field investigations, because the
Right,
desk
field.
investigations are increasing, but the field are decreasing. Does that have to do with the
Right.
the sterile compounding?
I'm sorry, I need to pull up the table, I apologize.
Yeah, in other words, I'm wondering if we have a higher volume of pharmacies and therefore percentage-wise, we're not getting as many.
Or less investigators, or?
Yeah, or
that
what?
is-
What's the reason? Yeah.
So that table is, sorry, I don't have it in front of me, but that table is reflecting the percentage of cases that we are getting done, not the number of cases, it's the percentage being completed within that time frame.
Right.
And so, so our investigation times themselves are longer right now in fiscal year 18-19 than let's say in 15-16, where in 15-16 we were closing, the performance standard is 120 days and we were having 71. In 18-19 we were at 44%, and
Right.
some of that is workload, some of that is redirection of staff to other functions. So, and then some of it is the complexity of the investigations that we have.
Okay. I just wanted to know. And then down in.
So wait a minute, a way you could look at that is field investigation performance standard is 120 days, so 44, I got you, so 44% in 18-19 met that 120, whereas in 15-16, 71% met it. I got you.
Okay, yeah, that's explanatory. Okay, then down in performance measures in the same thing, it says that,
Can I just interrupt? Do we need to explain why? I mean, why is it taking longer?
I mean, I guess if that's my question, somebody else is
we're
going to
kind
have
of
that
stating-
question too.
I mean, if
So-
I was someone looking at this, I would
Right.
say, why?
Well, I think that's so can we put a brief, is there any objection to us putting a brief summary explaining the numbers?
Right,
Yes.
Yep.
Are we all good with that?
Yep.
yep, that
move
was the point. Okay, then down in performance measures, it said that we established the following performance measures, and the second one is close all administrative cases within 1 year. And I'm saying, is that really realistic, given that down in the next paragraph, it says that we're closing about 21% of cases of that go to the Office of Attorney General within 1 year. So is it realistic to have the performance measure of closing everything in 1 year when we're actually closing 21%?
So these performance measures were established, I believe, through the Consumer Protection Enforcement Initiative. I do believe that when we have received presentations from the AG's office, their goal is to get to 1 year for closing. So I do think that the performance measure is, I believe, a target that we established that I believe is shared with the AG's office. I just think that they're not there yet.
So we're still going to set this performance measure, but I guess that's their doing, not ours. Is that correct?
So I
The
think that
AG's
we
office.
established the performance measure, but I think that the AG's office has publicly indicated that that's, I'm looking at Christina to make sure, that I believe that that is their goal. And I think in the last report that they gave, I think that they were saying 12 to 18 months.
And I can confirm that is our goal. It's obviously an ambitious goal. I do think it's doable, and obviously my supervisors and superiors think that it's doable, but it is certainly ambitious. But that is our goal, and we keep striving to do it. And I think our percentages have gone up. I don't have those numbers in front of me, though.
Okay.
But I think, Greg, your point is we should try to kind of clean this up because
Yeah.
it's a little confusing.
Exactly.
Because this is the board and that sentence kind of is the AG, and I don't know if we need to have another bullet that says something about the AG or somehow.
Yeah, in other words, to tie it together, so to explain that it is their goal. They're not there yet, but they're hoping to get there.
Well, it's sort of, there's two different goals.
Yeah.
Yeah, there's
Once
multiple
it comes to us,
goals.
then it gets to them. We have no
Right.
control once they have it.
Exactly.
So my suggestion, if you're going to tinker with this, it would be to only clarify what our goal is, because it's tough to have goals that we have no control over.
Good
Because when we
point.
put into a report, it looks like we're not, achieving our goal, even though we're a partnership. There's different other factors.
Mhm.
But I would only put down what our goal is. It's just,
And I do think that that's difficult because there are factors that go back and forth between us. You know, there are certain time periods where board staff needs to weigh in versus work that the AG's office needs to do and back and forth. Additionally, and don't forget, some of these cases that, we are all handling are extremely complicated and are definitely going to take longer than a year. Our goal is to get our average down to a year, because some cases are a lot shorter. Statement of issues get tried quicker, things like that can really bring our averages down.
I have a comment about that because I hear what Mr. Brooks is saying, and I'm wondering if there's a happy medium here because the public, which may not read this report, but the public's perception of turnaround time doesn't matter who, they just know it's taking a long time.
Right.
So the perception and the education of our public is important, and maybe there's some way to write the report or to include in the report, if we're looking at areas of responsibility in a different way. But I think it is important that we address the issue of we have a goal and we're not meeting the goal. The we is the collective we. And I can see the point that you don't want to say we being the board or we being the AG's office. It's a collective thing. How to report that out, and maybe there's a different format to call that out, but I think what's more important to the public is the overall turnaround time.
So are we going to do anything to it or not? I guess not. Okay.
here's the process.
My next,
So I guess everything I just said didn't count, is
Yeah,
what
it
you're.
did.
Well,
Another
so
question.
thank you.
So maybe
Yeah.
what we should do is this insert, because we do have a flow chart that shows the process. And so the public can at least see, once a case comes in, first, here are the first stop, second stop, third stop, AG's office, back to the board, hearing gets set, or whatever that flow chart process is. And maybe that might bring some more clarity to it.
I think the clarity is important. My question would be to the staff and to those that are familiar with the audience for the Sunset Report. If it fits for the audience, great. But if it doesn't fit, then that tool could be used to deal with the education and perception of our regulated public.
right.
So I would leave that to those who are putting the report together as to who is the audience and what would they find that helpful.
So I trust that notes are being taken
Brian's watching me.
She's on it.
He's catching all my typos.
She's on it.
right. Okay. On page 66, where we have cite and fine, the fines assessed and fines collected in the 2018-19, the reason it's only half is because we're only halfway through. Is that right?
No, so I do think that I'll provide some context to that. What this really reflects is the outcomes of the discussions with respect to fines themselves and the policy direction that you all have
Right.
given us with respect to cite and fine. So I'll put
Education
some
versus-
context into those
Right.
numbers. Yep.
Okay, thank you. Yeah, we're continuing the policy of educate as opposed to punish.
So I actually like this 5 most common violations for which citations are issued. Do we have, I don't remember seeing something like that for discipline. Do we identify under discipline the most common reasons for discipline?
We can.
'Cause I think that's
Yeah.
very
That's
nice.
a good idea. On page 88, 1, 2, 3, 4, 5 paragraphs down, it says, the board continues to provide statistics. Should that be the staff or the board provides statistics? Or are you considering the staff as the board in?
Yeah, I don't think that,
Cumulative
yes,
board,
we're
not
we're
the
not
board.
delineating throughout the report.
Okay, but then it says statistics on a quarterly basis, continues to provide statistics on a quarterly basis to the board as part of its quarterly meetings.
Please talk in your microphone.
Okay. The board continues to provide statistics on a quarterly basis. Oh yeah, it says the board continues to provide statistics on a quarterly basis to the board. So the board's providing to the board? That sounds a little awkward. Okay, but as part of its quarterly meetings, and that goes on to say, and until recently, posted the information on the website. Should we say why we're not doing it anymore? No.
Oh, it's an ADA compliance issue, but yes.
Okay.
I'm like, were you looking for the answer or just to put it in?
So I actually have a question about like, the sections that we have, are these established from prior sunset?
They're linked to the template report that we gave. So the Senate Business and Professions and Assembly Business and Professions give you a report template, and they're the ones that drive both the questions, the tables, and the sections and
Okay.
everything. And then our headings are intended to help them link back to their report template, because we don't do a Q&A. Like, we don't write the question and then give the answer. We're trying to make it read a little bit easier.
Yeah, but some of these things seems like, well, you could put that under licensing or whatever, but I got you, okay. Then I
Okay.
won't cut up the slacks.
Then on the same page, Consumer Protection Enforcement Initiative, the CPEI comprised a 3-pronged solution designed to ensure that investigations are completed and final action is taken against a licensee within 12 to 18 months. Now, that's not really happening, is it?
No, but that's what the CPEI goal was. And that was driven by the administration, if I'm remembering correctly. That was not a performance measure that we established. It came through the CPEI and through DCA.
Should we say something about the fact that it isn't really happening? Or?
Well, it says that we are committed to both the intent and the spirit.
That's good enough for me.
Okay. Hey, guys, we're up to section 10 already. It's a good thing.
Can I just confirm there were no comments on the licensing section?
I haven't heard any, so
Okay.
you can confirm it.
The licensing section from before, right? That was like section 3, it was like a bunch of graphs.
So section 3 was fiscal, section 4 is. Section 3 is fiscal, section 4 was licensing. And then we skipped to, so we went from section 3 to section 5, which was enforcement. I just wanted to make sure that that
Yeah.
was correct.
Okay, so we're back up to the new issues, and I guess I'm a little confused about, Maria, what you want to do with this?
It's not really a question of what to do with it. It was, I thought that this was actually the most pertinent part of the report, because it is almost essentially similar to strategic planning or identification of gaps or issues.
Right.
So we find these things to be significant enough to draw attention to. So that's why they're here.
Right.
So my comment was, is that they're here because we have previously talked about them? Or are we to talk about them now? And is there anything missing that we should highlight?
Okay, so we should talk about them now. If anybody has anything they want to talk about.
And can I just say that the issue, there's one issue indicated under issues raised under prior. Actually, I researched and you guys did actually complete that in April of 2016. So that has been corrected in the report. Not in your version because it was after it was released.
So essentially that's previously identified, that'd be similar to old business. So we'll have nothing in that section?
Correct.
Okay. Trying to catch the page.
Yeah, well, I don't have any more comments. Does anybody else?
The regulation issues, I was thinking that we had issue number 2, and maybe I'm misunderstanding this, but I was thinking that we had regulation packages that we were trying to get through the system, and they weren't going through very fast. And I feel like this is written very positively. I don't want to be Debbie Downer, but I mean, do we need to like say anything in here, like address that in here, or is that like inappropriate?
So when I had originally done this, I did have a chart in there that detailed out the different regulations and their statuses and that kind of thing. And I'm happy to put that back in if you believe that that provides more context. That was one of the items that I wanted to discuss because the last time that we were going through, there was absolutely concern with how long regulations were taking. And so we discussed what those challenges were, and a lot of it was related to 493. And so things have happened outside of our control, and you don't ever want to throw anybody under a bus or whatever, but we can absolutely, I'm happy to put the table back in that provides a little bit of context, because I do believe that the table shows that you all are doing absolutely what you need to in a very timely fashion with respect to initiating doing your work to initiate the process. If that's something that you would like, I'm happy to put it back in.
Well, I think it's reasonable. I mean, I am trying to be politically sensitive and not throwing people under the bus, too. So, I mean, I don't know how seriously people take this, and I don't want to make enemies where it's inappropriate. But if it's appropriate, I think we should say, hey, we're kind of doing our part. I don't know if others agree.
I agree.
And I do like in the budgeting part how, here we've gone to all this to restructure our fee schedule, increase everything, but regrettably, we've been advised of the increase of billing rate from the Attorney General's that, kind of set us back. So I'm glad that you pointed that out.
So I had a question about the term or the period is this report covers. You said that it goes through June?
Yes, it's a 4-year fiscal year, 4 years.
So it goes through June, but
The past June 2018.
I mean, sorry, 2019.
Right,
So we're
yeah.
reporting backwards.
But it's the 18-19 year.
So because
So through June of 2019.
right, so a lot of the things that that we have challenges and have urgency on now have been since then, including the discussion about the CPGE. But it's in the report.
Right.
Is that's because it's a high-profile event? So none of the others that are challenged now with appointments, having a quorum, those didn't meet the need to be highlighted or addressed to give us some traction.
Actually, I think they should as new issues. Those are good points.
Right. So
But that
that's-
was after July.
Yeah, so that's what the discussion is all about, to like, if you want me to add in that, I will, right? Give
And-
me the feedback.
Yes. And then the other part is I don't know if it is appropriate for here, but the difficulty in and having your position still be interim. Is that something that would be appropriate to put in here or not appropriate? Because it's more of a DCA kind of issue.
So I think that we referenced, I didn't say it as a challenge, so tell me what you want me to say. We did reference that the board has completed its work with respect to the
Right,
recruitment, and
and
they're
that we're
waiting, so
waiting
that
for
is
approval.
in here. But I can call that out as a new issue as well if you would
And
like.
I guess it's to me, because this is, I've read these reports in the years past, and it's kind of like, I read it from a more of a layperson's point of view, so I don't know who the audience is and how they read it, per se. But the things at the end are the stuff I go to first. Is like, okay, what are the big issues that now I can go back and look at the minutia and the detail later? So if it is appropriate to call out some of those things, I think it's important.
I think it is, yeah.
And I'm not sure if you want to link those two together or whether it is appropriate to say something about the interim EO position as its own separate issue without causing undue consternation with the other processes that are going on. The other thing that I'm not sure if it's appropriate to call out here because it's so brand new is the chaos that USP has put us under. And if that's something that is, because I know that has come to the legislature's attention in certain aspects from their constituents, whether that's appropriate or not. That's just a question.
Would that be under new issues, identified new issues not previously discussed? Is that where you would put the compounding?
I'm not sure if it's appropriate for here, and then if it is
I
appropriate
think,
for here, where?
I think it is appropriate for her. That's why
Yeah.
I think I
hope
was
so.
kind of.
Were you
the
wondering
ad
if it
hoc
should be in
committee
next
thing, I
year's
thought
or
was
this
not
year's?
That's why I was asking about the term that this
Yeah.
covers, because it seems like it's kind of wishy-washy to me. It's not like a financial report where it's like cuts off. It
Yeah.
seems like you can bring some stuff in.
I think you can because we haven't submitted it yet, and it is a new issue, and it's something we're dealing with.
Yeah, so I might want to think that through a little bit to see where we put the USP issue in the report, if that's okay to work with.
And I'm fine with it not being here. It just is.
No, I think.
I think it
would-
should be,
I think
yeah.
it should be. I think it's,
I agree.
I mean, that's why back here in the beginning, we had the ad hoc committee, I think compounding is big, and just to call it ad hoc and then in the small print say it's compounding, I thought that was a possible miss.
And I think it's also a good time to highlight how California has led the nation in this extremely complex patient safety issue for many years, and that the representatives of our board have participated at a national level in the discussion. I think that's a kudo to the board that we are participating at the national level.
So on page 109, does this imply that Alan Shad, he's like, but it doesn't look like he ever really attends anything. Oh, that's the roster.
That's what she meant.
I guess one more thing. I'm just not quite sure the political process for this. Is this an opportunity somewhere in this document to really call out the support that the board has for disasters and the providing medications in disaster settings? I think that could provide some traction and some information, even if it's just informational somewhere in there. What I do really appreciate, maybe this is a side issue, but is that the just-in-time information that the board sends out by its email blasts, that it doesn't require an individual to go and do research or to remember, but the board is constantly reminding pharmacists out in the communities that they have the ability, the capability, and actually the duty to follow the regulations to provide medications for patients.
I mean, excuse me, I think you're right on hitting the nail on the head, especially with all the recent fires over the past couple of years.
Right.
We've gone and had special meetings to suspend the rules to allow pharmacists to provide, medications, just in time, basically. I think that should be highlighted, because I mean, that's a big deal, especially in today's political environment.
I mean, seems like new issues not previously discussed in this report would be a good place for that.
And maybe the side issue, which could be highlighted in that, but that the board is going out to be proactively reminding the regulated community as to what their role and responsibilities are. Instead of just having it be, like we had previously said, that it's on the website and it's available if you go look. The board is not waiting for you to go look. They're sending it out and saying, this is what's out there for you, do it now.
Well, I mean, along those lines, I think I like your line of your approach. Maybe you should also include as a highlight, because of the opioid epidemic, our work we've done on Noxalone and trying to get it out, and what the Board of Pharmacy has done to forward that progress. Because once again, you look at the politics and something that's what everyone's experiencing today, might be something good to highlight.
Excellent. I like that too.
So I was just going to say, in the public information policies, there's public information to licensees, so that might be a place to put, some of this outreach. Somewhere in here, I remember reading about, the Twitter account that Bob started, and
So one of the things that maybe we want to consider doing is doing some sort of an accomplishments table. And maybe we start with that, honestly, right?
Yeah.
Well, because we were going to do a cover letter under the president's name where we kind of highlight some of it, but maybe we pull together some sort of an accomplishments things where we just really just kind of tick off some of the things, and then we can provide it. We'll find areas to provide additional context throughout them as well. But definitely highlight. We're pulling together. I actually have what we've done, pulling together the accomplishments of the different committees, because really the committees do the work and then the board is, taking action.
yeah, I
on it.
mean,
So
look at the
we have
beginning
that
here.
highlighted.
Maybe change even this brief history, like, Greg was talking about, that's where you put the accomplishments.
Yeah, so we'll pull together like some sort of way to just, that's what they're going to hit first. Okay.
That would be great. And a place to look is right on our own website, is to look at some of the things that we highlight, like some of the educational events. The Narcan is on there, but also the issue with, I'm not sure if this will be a hot button issue positive or hot button issue negative, is the issue with cannabinoids. And that could cause some attention.
All right.
Well, we actually did accomplish something there.
So I just want to confirm that in terms of the new issues we're going to add in addition to what's in there, I'm assuming you agree with what's in there. We're going to build on that and add in quorum, hiring of an EO, the USP delays, and then we're going to be creating an accomplishment document. Those all seem like pretty significant changes, so I just wanted to make sure that we're,
Yes.
yeah.
And I think also and you got the natural disasters, like how we're going, with all the
Right,
fires.
so I think
Okay.
that's going to be as part of the accomplishments thing,
Okay.
if that's agreeable. But we can make it, we can also honestly make that an issue, because although we've got good policy in this area and we're doing a lot of education, there's still a lot that needs to get done. So maybe we do it in both places and we talk about what still needs to get done for patients.
Sure. Okay, good. Now, we were going to be doing the compounding committee report now. However, we need to go into closed session for another matter. You need a motion?
I do think that I
to
need a
ex-
motion on this.
Okay.
Oh, public comment?
Yeah, well, we can do the motion and then get public comment. So the motion would be to approve subject to the changes that we discussed. Is that correct?
And then I think maybe you want to include in there that non-substantive changes, if members want to send in non-substantive changes or whatever, and then determine if you're going to delegate to a person to then verify all of it. I would suggest that
Okay.
that all be in there.
So can we have a motion to that effect?
So move.
Good. Thank you. Okay, public comment.
Steve Gray, a pharmacist of many experiences, including with large health organizations. I want to go back. The way you outlined the way this was going to go, you guys are going to have a big discussion, and then we're going to have public comments, maybe starting back a little bit.
Right.
And that's fine. I'm okay with that. One of the first things you talked about was where you're doing inspections, and should there be any other inspections that the Board of Pharmacy should take on that they weren't doing. And what I want to call to the board's attention, and I know it's going to be very controversial, and it's going to be a lot of work if you agree to it, but the Board of Pharmacy is the only authority within the state that can effectively, and in my opinion should be effectively, inspecting drug supplies in medical offices, in clinics. The board has the statutory authority to do that. If it finds something, as I remember the statute, it has to turn it over to the medical board or the dental board or whoever is responsible for taking action. But we are increasingly in medical offices throughout the state having a lot of very serious drugs that could be deteriorating from poor storage or could be subject to diversion. And we found this out big time a few years ago for the states running under the delegation of federal authority, the Vaccines with Children program. And there were vaccines that were stored in what they went on inspection called dormitory refrigerators. So those are those little $79 refrigerators you can get at Walmart that don't have a separate freezer. And so the vaccines were being frozen sometimes. There was no monitoring of them.
Weren't they also expired?
And they were expired, and there was no, and this has been an issue particularly with the disasters that you just talked about. Because when the power is shut off, these medical offices, many of them pediatric offices and clinics, have no backup power. And all of those, the polio vaccine is thawing out, and once it's thawed out, it's useless. And then people are just turning it back on and using it again. So that's with the vaccines, and the state, did this analysis on the Vaccines for Children program because the federal government requires audits. But when it was out there, they also found biologicals that weren't being stored properly. We're talking about serious cancer drugs. We're talking about all kinds of very, not only expensive, but dangerous drugs that perhaps are being deteriorated because of lack of poor storage. And no state authority is going in and inspecting it to any significant degree. So I think the board should have a discussion about whether this is its responsibility, since it has the statutory authority explicitly, and because it's a major public protection issue. I know of one instance where when it was discovered that the vaccines had been out of refrigeration control for a significant period of time, 400 to 600 children had to be recalled back into the organization to be either have titers or to have them revaccinated. And that's just one example of what's going on out there. So I think the board should bring this to the attention of the legislature and say, okay, is this a problem that the Board of Pharmacy should go forward with its statutory authority, or is this, and get the funds to do it, or whatever it's going to take, or is this a problem that somebody else should take on? And again, I emphasize with the new drugs out there, they're not like the old drugs where it's just a coated tablet or a gelatin capsule. These biologics and others are very serious drugs. And with the new USP 800, who's going to be really inspecting whether those are kept in a place and a way that protects the individuals who are handling those drugs in those facilities? And again, if I know of an organization that didn't do it, and they have to follow the children and the grandchildren for birth defects for the rest of their lives of the nurses that were exposed to those drugs in a particular facility. That was the settlement that was reached. So it's very serious. And I suggest you take a look at that and see if that's something that should take on. Other states, in some states, the physicians have to get a permit from the Board of Pharmacy to even receive drugs, and also that explicitly gives them the authority again to go in and inspect and take action. They can revoke the permit for physicians to actually even get drugs, which means they can diagnose but they can't treat. So I think it's something you need to look into, and I would suggest you consider adding that to your sunset report. Thank you.
Thank you. Other comments?
Hi, Christine Verskell. I just wanted to, did you say that you were going to go to closed
Yeah,
session?
there's something came up. We have to go into a closed session.
Okay, because
didn't
there's a lot of
intend.
people here that were counting on the
The
agenda
compound.
and can't make it tomorrow. So,
Is there any particular issue or concern?
Is it something that,
Just so we know.
yeah, can we get it done in a relatively short period of time, or? The issue here is,
What agenda item? What agenda item?
it's the compounding committee, right?
just the compounding committee.
Okay, what,
Oh.
can we do that? or-
Yeah, yes, I think you should probably finish up the item that you're working on right now, and then see if you can take the comment from the people.
You don't have to leave?
The other option
Okay.
is maybe we could just go to closed session for like 10 or 15 minutes and then come back out and
Yeah, we can do that, okay.
Yeah, I mean,
We'll go in.
respectfully, your time I get.
Pl- Yeah, if you can stay like 15, 20 minutes, we'll go into closed session and come out
I'm
of
going
it.
to get on Highway 5 at 5 o'clock.
Well, I hate to tell you.
Yeah.
You're going to be
Sorry,
on
yeah.
Highway
I'll
5
wait
at 5
15
anyway.
minutes, that's fine. yeah.
Okay, that should be long enough. Thank you.
So let's, we'll finish public comment, close the item, go into closed session, reconvene.
Yeah, I think public
Well, you have
comment's
to-
done
you have
on
to
this.
finish out your
Yeah,
order.
that's what I just said.
Yeah.
Yeah.
Yeah, but we don't have any more public comment on this, right? No. Okay, so we're done with the sunset.
No, you have to vote, and then also I think you want to identify who's
I
going to.
mean, we're done without, until, now we will have our vote, okay? But we're done with the public comment. Okay. So, we have the motion, we have a second. We have a motion and a second. All those in favor of the motion? Huh? Alan, where'd he go?
He took a vote.
We have a quorum anyway, okay. All those in favor of the motion, raise your hand. Okay, passes.
And before you move on, and I apologize if I didn't hear it, but did you identify who's going to make the final determination in that motion
No, we didn't.
about the final language, just the final approval?
That's going to be it, isn't it? Or does it need to be a board?
Yeah. I think it can be Ann, but maybe with the,
With
I
me?
think you had indicated that members could provide feedback to her.
Yeah, members can provide feedback, but the final thing will be Ann, right?
So but I thought it was going to be in one board member.
Yeah, Ann and one board member.
Yeah, and so I think the question is who's the one board member?
Okay, well, I think since Debbie Veal has been through this sunset more than once, I think she'd be the right one if she wants to do it.
I second that.
I love working with Ann, so.
Okay, great. So that's done.
So,
since you're delegating that authority, I would actually make that a motion.
Okay, I will make that a motion, that I delegate that authority to Ann and Debbie to provide information.
second.
All those in favor? Okay. Thank you.
So
Now-
should we go to closed session to open back up at?
Yes.
You have one more thing in the org report to go through. You have personnel update in the org report.
Oh, okay.
I think it's information only.
It is.
So I say because of timing, that's information only, we don't have to.
Yeah, that's information only, so, and you've got it in your materials, so let's go into closed session and, so that we can then come back and deal with the compound committee. So get out of here.
Yes.
We'll open up the door once they're done. Okay.
Okay. We will now have the report from the compounding committee. Maria, the floor is yours.
Thank you. We had a compounding meeting this morning, and the 3 items on the agenda for our meeting today were discussed during that meeting. The first item that we have is, I should reiterate that the board has received a summary of the committee's work from the September 5th, 24th, and today's November 5th meetings, as well as updates for discussion and action as necessary. The first item on the agenda is discussion and consideration of draft policy statement regarding applicability of board compounding regulations and USB compounding chapters while pending appeals before USP. As you all are aware, September 23rd, USP announced a delay in the official date of the revised chapters 795, 797, and new USP chapters 825 until further notice. The delay results from appeals received on certain provisions in the respective USP chapters. Details about those appeals are on the USP website. Since the beginning of the year, the committee has dedicated several meetings to educate on the proposed revised and new chapters. Following education over several meetings, the committee transitioned its work to evaluating regulations necessary to clarify, make more specific, and necessary to ensure patient safety processes consistent with the board's mandate. In light of the delay, it is appropriate for the committee to discuss any actions for us to consider. So the committee did discuss actions, and during the committee meeting, we considered a draft policy statement that was intended to provide clarification to the board's regulated public about the intentions on pharmacy compounding regulations during the appeal process. So this morning, we went over what you have in your package is a draft policy statement, and like to, I guess I have to make the motion before we make the amendment, because we have a couple of amendments to the original package, and so what's being passed out now includes the amended version, amended language. So, Mr. President, should we have a motion first and then an amendment, or how would you like to deal with that?
Yeah, let's do the motion first, so.
Okay.
Well, we don't need, it's a committee motion,
The committee motion, right?
so we don't have to have a second.
Okay. So before discussion, I'd like to add amendment to the policy statement. And it's not highlighted on here, but the 2 sections that were changed from the package that was in the back of the room and that was in the email or in the website is on paragraph 2, the last sentence. I don't have it highlighted on here, Ann, but I think this is correct. Correct me if I'm wrong. last sentence currently, or will now read, further, effective January 1, 2020, in addition to the board's compounding regulations, all pharmacies must adhere to current USP chapters relating to compounding, including chapters 795 and 797. So the words were added were, in addition to the board's compounding regulations.
Right.
The group this morning thought that that would add clarity to that section. And then the second area that was changed as part of this amendment is in which paragraph? Let's see.
It's the third paragraph last sentence.
A total addition of that last sentence. Originally, it ended at sunset on December 1st, 2019. And so after discussion and public comment, we are adding the sentence, while the USP appeals are under consideration where physical construction or alteration is not yet complete, the board will consider mitigation, including the licensee's efforts to achieve compliance. And we're hoping that those two additions help clarify and deal with the issues that were brought up during public comment.
So let's have public comment now.
It's December 1st. Thank you for staying, BJ, all day.
True confessions, I did not stay all day. I came and went.
Oh, you
guys
shouldn't have told us that.
You guys are the soldiers here. BJ Bartleson from the California Hospital Association. And first and foremost, I'd like to thank the board for their efficiency and their effectiveness and for listening. I think you all realize that the hospitals have been doing yeoman's effort to be in compliance with these kind of odds and ends and the complexities, and I think this will help us greatly. So I like the terminology, I like the wording. Still a little worried about some of the ambiguities, but that's because I don't know enough about them, and I know that my pharmacist leaders in the Hospital Association will keep me informed. So I'm very happy with this. Thank you very much. And just for information, we are having a webinar next week. Board of Pharmacy has been very helpful and will be presenting. So again, we can remind folks of the policy statement and the wordings that you've used to help us get through it all.
Great.
So thank you very much.
Thank you. Next. This is what you've been waiting for.
Marie Kottman from Pacific Compounding Pharmacy, representing myself. I thank you again for the opportunity to speak to you. I really do appreciate the rulemaking process that the board has, and I have appreciated the opportunity to be a part of it over the last several years as we've been reviewing and revising and improving the bar for compounding in the state of California. But I'm a little disappointed as we're moving into an age where USP is actually writing our laws for us. And I think that you have heard me comment in the past, I've been the black sheep of the audience saying, I don't think we should adopt USP as our law. I think we should continue our own rulemaking process. And I think that we're seeing some of the problems with allowing another body, i.e. USP, write our laws when we're in the process of doing multiple rulemakings based off of their rules, and then they yank the rug right out from under us on September 23rd. It's creating a lot of confusion in the world of compounding pharmacy, especially in sterile. Their rules are not written as rules. We're going to adopt them as rules, but they aren't written that way. And so you'll find that in USP Chapter 797, with regard, this is just one example that I'll give you today. I don't want to go into too much, but in USP 797, it says that you need to use a non-shedding gown when you're doing sterile compounding. Okay, most of your compounders are going to read diligently 797 and 795 and 800, correct? However, as mentioned previously in other meetings, there are about 25 other chapters of USP that are relevant to compounding, including Chapter 1116. 1116 is titled Aseptic Processing Environments, Microbiological Control and Monitoring of Aseptic Processing Environments. In this section, it doesn't say that you need a non-shedding gown for sterile compounding. It says you need a sterile non-shedding gown for sterile compounding. It's a minor but very significant difference for those of us who want to hold the bar high and who are reading deeper into these rules and regulations and understand them fairly well. There's a lot of details in there. But here's where the difference, here's where the rubber meets the road, okay? You got a compounder like myself. I do want to hold the bar high. I want to keep my patients safe. I need to sleep at night, okay? I don't want to make any mistakes, and I don't want to compromise patient safety by cutting corners. So for the last 3 years, we've been doing sterile gowns. Sterile gowning costs me $17 per employee at minimum per day who goes into the clean room. A non-shedding gown costs about $3. Okay? So for me, that's not a really big deal. I really don't have a problem with it. But where the rubber hits the road is where you have access to our public, our patients in California. My compounds cost more.
Right. Are you saying that our regulations do not state that? Because we're saying that in addition to our regulations, we must adhere to 795 and 797, meaning that if our regulations are more restrictive, then we have to follow
Our regulations indicate a non-shed or low lint gown. I'm not sure which.
They don't say
non-shedding or low lint.
sterile?
They do not say sterile. And so the ambiguity remains. And what I want this board, the entire board, not just the committee, to hear is that abdicating our rulemaking process to another body and allowing them to write the rules, even if we're going to write over them, creates a lot of confusion and ambiguity in the world of compounding that needs to be as specific and precise in order to keep our patients safe. And some things don't have to be as specific and precise, but in things like this, it really can make a big difference. So your licensees are going to read 797. How many of your licensees are actually going to go so far as to read every other chapter listed in USP 795 and 797? If you read the title of this one, Microbiological Control and Monitoring, they're probably thinking this is surface plates, not sterile gowning. So it leads a lot of confusion. When we wrote our rules for compounding over the last several years, we got very nitty-gritty and granular. We got very specific, and it was a long and arduous process. But we had a set of rules that were clear, easy to well, I thought they were easy to understand and easy to comply with. This set of rules, when we're using the USP, all their different chapters, some revised, some not revised. Now we're going backwards in time to 2008 guidelines. Whoa, way behind the times. And then on top of that, we're going to put our own rules because theirs aren't good enough in the first place. So I hope that this board sees that potentially going forward, I know it's too late. The law's already been written, the statute's already there for January 2020. We will comply. I get that. We will go with the strictest rule we can find and we will meet that. Okay, I can do that. But going forward, maybe this board can choose to write our own rules so that your licensees have a better chance of complying and keeping your public safe, your constituents safe.
Thank you.
Thank you for the audience.
Steve Gray, as an individual and probably representative on this, although it hasn't been discussed by CSHP. Those of you that have been following this sterile compounding regulation process for many years may remember that we had a problem with the 2008 version of sterile compounding in USP 797. And the problem was that that version says that no person can do any type of sterile compounding if on their body they have any kind of a sore anywhere on their body, or a puncture in their body that might be shedding cells, etc. And it didn't have the qualifier word in there, exposed. And so there was a lot of controversy. What did that really mean? Did that mean, and this may sound silly, but these were the questions that came up. Does that mean we have to strip search technicians to make sure they don't have athlete's foot, even though they're wearing socks and shoes and sterile booties, or other parts of the body? If they have a nose ring, as long as they're wearing a sterile mask, or even like some GMP places do, the whole helmet that was sterile. What does it mean? And then what does it mean after the fact if we found that they did a whole batch and then afterwards we found out that that person didn't report, that they had herpes on their abdomen or something of that nature? Does that mean we have to recall all of the product that they tested and warn the patients that might have received that? So these were the questions come up. And what this board did, rightly so, is they put into the California regulations the fact that it was only a problem if it was exposed, right? But now we're going back to 2008, and the question then is putting exposed in there a lesser standard, because the new statute says that the board can only do additional standards, which was interpreted to be higher standards. And we brought that statutory problem to the board's attention and said, why would you want to take away your authority when you knew it was wrong to do something that was different? So you're going to get that question again, because now, according to this statement, you have to follow the 2008 and the board's regulation. But in that case, you'll have to give some guidance about whether that particular or other 2008 is an additional, more strict standard, or the board is a more additional strict standard as you go forward. And if this is going to be a valid statement of policy after January 1, then that could persist for quite a while. So I just want to, again, bring that to your attention. But I do, as the two previous speakers say, I think it was really good that you came out and you did respond to some of the questions we had by adjusting the statement. I think that is a very positive sign, but it is not necessarily the end of the story. Thank you.
Hi, Christine Verskell with Dynalabs. As you know, we're a quality assurance quality lab. We service compounding pharmacy, whether it's 503A, 503B, hospital pharmacists. There's so much confusion out there. We try to help them align with what is required to from the regulations, and trying to answer questions and guide them in the right direction. What we're seeing about a year ago is some people just giving, I quit, I'm not going to compound anymore. We're seeing more of that, to the extent where it's alarming, I think. And it might impact access to medications to certain people and populations. As far as USP and the delay, there are a lot of people that made comment, and a lot of the comment was around BUDs. And we find that we've got customers that have spent a lot of money on stability studies, and we recommend the highest grade stability study that you can get. And right now, those people are on hold. They don't know if they should do an extended BUD, what that will be, but also with USP and them limiting to 30 days and 45 days on a BUD, there's nothing that says that you have to prove that you have that 30-day or that 45, that your product is stable and that it's sterile. So you're going to have people that are going to, there's many of these pharmacies do it by the book, want to do the right thing. But you're going to have those outliers that just say, well, if USP lets me assign a 30-day or 45-day, that's what I'm going to do, and I'm not going to do anything to prove that my product's stable or sterile. So this one.
We're about to lose a quorum, so I think that you need to vote on the policy statement.
Okay. Thank you.
Actually, the other two are really quick.
So, yeah, we want to approve it. Okay.
They do require a vote, yeah. So,
Okay, so is there any additional public comment on the policy statement? Is there any additional public comment on the policy statement? No. Okay, and we have do we have a motion to approve? We have a motion and a second, right?
And the amendments.
We didn't need a second because it was a committee motion. Okay, all those in favor of approving the policy statement, raise your hand. Okay, unanimous. Thank you.
Thank you. Item B is discussion and consideration of the timing of the formal rulemaking process for proposed regulations of non-sterile preparations. And the committee discussed where we are on the non-sterile preparations and the regulations. On July 11th, we approved proposed regulations to repeal and add new sections 1735 and 1735.15. And when I say we, it was the entire board, the full board. Those are relating to non-sterile preparations. The committee discussed this process, and in consideration of the draft policy statement, we thought it'd be appropriate to ask the board to, I'm looking for where it actually says, we're looking to ask the board to reconsider moving forward on the regulations and the rulemaking process and until we have more information from USP. So at this point, the board was moving forward on the rulemaking process, and the committee is asking, the committee's motion is to postpone moving forward on the rulemaking process.
Right. Do we have any member comment? Public comment? Okay, all those in favor, raise your hand. Thank you.
Okay.
Now,
I have one more.
Oh, okay, go ahead, because I wanted to add something, but,
Oh, okay, about non-sterile?
no, go ahead.
The last one is more informational. Originally, the committee had proposed regulations and was considering moving forward on the rulemaking process for pharmaceutical compounding of sterile preparations. At our committee's meeting, we decided not to move forward. While we do have proposed regulations, we're not asking for the initiation of rulemaking at this time. That we don't need a vote, right?
No. Okay.
That's it.
I think,
Do we need that?
I guess I look to council on that because it was a prior committee recommendation. Because it was a prior committee recommendation, I don't know. The
So
board
we
had
need-
not
This
considered
morning-
it previously.
This morning, the committee changed their recommendation.
But I think since the committee nullified its own act, I don't think the board itself as a whole needs to.
We don't need to do anything. Okay, now, at earlier in the board meeting, in the items that were not on the agenda, Danny Martinez recommended that we send, based on his letter, that we send back to the compounding committee related to the methylcobalamin. And so I wanted to suggest that we do that. Now, do we have to, what's the process in getting it back to the?
Can I just speak for 1 second? That is that the committee will be considering 1751 again because we have not finished and asked for rulemaking. So that would be appropriate to bring up at that time. So we will be having a committee meeting talking about 1751.
Okay, does that work?
Is that correct, Ann? Am I stating it correctly?
I think that it's your decision. So if you want to revisit it, we'll agendize the meeting accordingly.
Do,
Okay.
Well, it sounds like they're going to.
but it sounds like that's when we do it. Is that
Okay.
correct?
That was all.
Okay, so that's when it will come up, correct? Okay. Okay, thank you. Okay. Please finish your report.
That's the end. That was the end of the report.
Oh,
Thank you.
Well, then finish it anyway.
I forgot to say thank you.
Okay, thank you. Thank you, good report. So we will now adjourn until tomorrow morning at 9 a.m. And thank you all for coming and participating. Hope to see you tomorrow.